The sun's down and suddenly a wave of sadness comes over you. You're struggling to complete your daily tasks and you're worried that this fatigue and lack of energy is just an annual routine. You visit the doctor worried and they diagnose you with seasonal affective disorder. First time you've heard of this? Let's dive deeper. Seasonal affective disorder is a type of depression that happens during specific seasons of the year, mostly fall or winter. Before we proceed to the specifics, let's first differentiate between major depression and seasonal affective disorder. Major depression is a mood disorder characterized by a variety of symptoms. Onset is triggered by various risk factors such as genetics. Meanwhile, seasonal affective disorder, or SAD, is a type of depression characterized by similar symptoms, however, triggered by seasonal changes. The shorter daylight times and longer dark hours may trigger a chemical change in the brain manifesting feelings of depression, especially during the cold winter seasons. Let's take a look at some research. A study by Drew et al. Found that an estimated 10 to 20% of depression cases are recurrent in a pattern that follows seasonal change. The specific link between reduced sunlight hours and depression onset is based on a particular hormone, melatonin. Melatonin is a sleep-related hormone secreted by the pineal gland in the brain. The hormone is produced much more in the dark, triggering feelings of drowsiness and fatigue more often. Let's take a look at all the connections we have made thus far. So ultimately, reduced daylight hours and reduced sunlight increases melatonin production. This in turn increases sleep and fatigue. Side effects of melatonin all foster the same symptoms as depression. This includes feeling sleepy and tired for longer hours during the day, irritability and restlessness, and increased nausea. There are two types of SAD. The fall onset, which is also known as winter depression. With the fall onset, symptoms begin late fall to early winter months. Symptoms begin reducing during the summer months. The second type is the spring onset, which can also be characterized as the summer depression. Symptoms begin in late spring with this one. However, this type is seen much less than the fall onset SAD. What are the specific symptoms of SAD? Excessive sleep, drowsiness, increased social isolation, and irritability are all symptoms that are seen under both types of SAD. SAD is diagnosed via multiple mental health exams alongside other illnesses such as cardiovascular diseases or cancer, and physical exams through blood testing. The blood testing particularly examines thyroid levels. Thyroid testing looks at thyroid hormones, which are responsible for the regulation of your metabolic rate. Particularly, over and under stimulation of thyroid hormones may manifest depressive symptoms. So when do these symptoms of SAD start? Seasonal affective disorder usually starts during adulthood and is seen to increase with age. These symptoms are also observed more in women than they are in men. Factors that may increase your risk of seasonal affective disorder include family history. People with SAD may be more likely to have blood relatives with SAD or another form of depression. Another factor is being predisposed to major depression or bipolar disorder. Having one of these conditions worsens the symptoms of SAD. Next, having low levels of vitamin D, which directly correlates with the shortened daylight hours, as Afero mentioned, is a risk factor. Lastly, SAD is common among people who live far north or south of the equator. This is because decreased sunlight during the winter and longer days during the summer months are observed. It is important to recognize that this depression, as well as others, is distinctive from feelings of sadness and is not simply a form of weakness. Therefore, it is crucial to seek treatment regarding this disorder. Despite there being no way to prevent SAD, there are multiple treatment options. Those include psychological treatments such as behavioral activation, which works on practice of behaviors that activate a positive emotional state, problem-solving therapy, which provides patients with the tools to identify and solve problems that arise from life stressors, And lastly, cognitive behavioral therapy, which is a common type of talk therapy known as psychotherapy, where patients work with mental health counselors to address emotional challenges. All of these treatment methods work to help alter any unhealthy views or outlooks one may have on themselves or just life in general. Another common SAD treatment is via light therapy, which is the exposure to specific light for a specific amount of time daily. The last resort are antidepressants, which are prescribed medications to help correct chemical imbalances of the brain that may manifest SAD. The same study by Drew et al. Established that physical activity and gym sociality have a strong correlation with the prevalence of experiencing symptoms of SAD. Now, what is the science behind this? Exercise. Exercise proves great benefit for anyone dealing with depression. This is because it helps to release endorphins, which are hormones that work to reduce pain as well as increase your metabolism. Overall, this results in improved energy levels and overall well-being. Exercising in groups may also be the preferred form of physical activity for motivational reasons. The main study finding was that the most effective outcomes were observed in participants when physical activity and bright light exposure were combined, reducing symptoms on the Hamilton Depression Scale from 40 to 66%. A study by Pizer et al. Explained that there was a 50% decrease in depressive symptoms due to physical activity, even around the wintertime where SAD symptoms are most prevalent. So what are some examples of physical activity that can be done in the winter to reduce these symptoms? Well, these include snowshoeing, skiing down the slopes, playing indoor/outdoor hockey, hiking along trails, and any regular gym activities. The winter weather often discourages people from performing physical activity, but it is the most crucial time of the year to be active and keep endorphin levels at a high to allow for increased overall well-being. Let's summarize the particular link between depression prevention and exercise. An increase in exercise and physical activity increases endorphin release in the brain, which suppresses the feelings of drowsiness among other symptoms of depression. This is especially in combination with light therapy. If you're ever feeling down or any of the symptoms mentioned in the video, please contact your healthcare provider for a checkup. Thank you for